welcome to my sleep therapy office. I understand that you would like me to be your personal sleep therapist. Is that correct? Excellent. Well, it's my pleasure to meet you. I am Dr. Wormers, and I will conduct a thorough sleep assessment for you today to find out what's causing you sleep issues and how we can work to correct them. This session will last approximately 30 minutes, in which we will conduct a sleep questionnaire, and then we will move on to different sleep techniques. There'll be a pillow menu, sleep tea sampling, sleep spray sampling, and candle and scent sampling, all designed to help you find what you really need to help you sleep. I've been in the business for many years now, so I will bring my expertise to help you in the bedroom with your sleep. Are you comfortable? Good. If you feel sleepy at any point, you may rest your head and close your eyes. That's no problem at all. I'm perfectly happy with my clients taking a nap during our session. After all, it would mean my work was complete. So, let me just get your sleep questionnaire ready. Alright. Okay. So this is our Murmurs Care Physician's Sleep Questionnaire. So please answer to the best of your knowledge and capabilities, okay? Please provide your full name. Your sex, age, the date today is November 2021. What is your date of birth? Okay. Do you know your height? Yeah, that's fine. And your weight? Do you know your neck size? No, that's fine. Okay. Referring physician is Dr. Murmurs. Alright, so we're going to look at your main sleep complaints. So just let me know if any of these apply. Trouble falling asleep. Trouble remaining asleep. Excessive sleepiness during the day. Snoring. Unwanted behaviors during sleep. These can be anything like sleepwalking, sleep talking, teeth grinding, drooling. Okay. Is there any other complaints? And how long have you had these sleep disturbances? Okay. Do you have a prior sleep diagnosis? Have you ever entered a sleep study or assessment? Are you prescribed a CPAP or bi-level pressure? Any medications that fall into that category? No. Are you given any oxygen during the day or night? Have you ever had surgery for a sleep disorder? Have you ever had a UPPP or a tonsillectomy? Do you use a dental device for sleep disordered breathing. Now, your sleep pattern. What time's your typical bedtime on a weekday? And on a weekend? And when do you typically awake? A weekday? Weekend? So, that's right, okay. So, how many of those hours would you say you're probably asleep for? Okay. How long does it take you to fall asleep at night? And how often would you wake per night? Right. What's the time that it takes to fall back asleep after awakening? Would you say your sleep pattern is regular? Do you awaken early in the morning but still tired, and however you're unable to return to sleep? Sleep environment habits. What's your typical sleep position? Is it back, side, stomach, head elevated, or in a chair? Do you sleep alone or do you share a bed with somebody? Would you say your bedroom is comfortable, noisy, too warm, or too cold? Do you have pets in the bedroom? Do you watch TV in bed prior to sleep? Do you read in bed prior to sleep? Do you work or study in bed? Do you drink alcohol prior to bedtime? Do you smoke prior to bedtime or when you awaken during the night? Do you eat a snack at bedtime? Do you eat if you're awakened during the night? Moving to breathing. Have you ever been told that you snore? Have you ever been told that you stop breathing while you sleep? Have you ever been told that you snore only when sleeping on your back? Have you been told or been awakened at night by your own snoring? Have you ever awoken at night choking or gasping for air? Have you awoken short of breath? Do you have trouble breathing when flat on your back? Do you have trouble breathing through your nose? Do you have morning headaches? Do you sweat a great deal at night? Daytime sleepiness. Do you often feel drowsy during the day more than you expect is normal? Do you feel unrefreshed or tired in the morning despite sleeping at night? Do you take daytime naps, and if so, how many? Do you have uncontrollable urges to fall asleep during the day? Do you have experienced lapses in time or blackouts? Have you ever fallen asleep while driving? Have you ever performed poorly in school or work because of sleepiness? Okay. So we're going to do the Epworth sleepiness scale, okay? So how likely are you to doze off or fall asleep in the following situations in contrast to feeling tired. So the scale, so 0 is I would never doze, 1 is a slight chance of dozing, 2 is a moderate chance of dozing, and 3 a high chance of dozing. Okay. Well, so when you're sitting and reading, watching the TV, sitting inactive in a public place like a theatre or meeting, as a passenger in a car for an hour without a break, lying down to rest in the afternoon when circumstances permit, sitting and talking with someone, sitting quietly after lunch without alcohol, in a car while stopped in traffic for a few minutes. Okay, just count your score. Alright. RLS. Do you kick or jerk your legs excessively during sleep? Do you experience a creeping, crawling or tingly sensation in legs when you try to fall asleep? Do you experience an inability to keep your legs still prior to falling asleep? Do you experience the feeling of restlessness in your legs at night? Next section is orexin related. Do you experience sudden muscle weakness in response to emotions such as laughter, anger, or surprise? Do you experience an inability to move while falling asleep or waking up? Have you ever experienced hallucinations or dream-like images when falling asleep or waking up? Have you frequently dreamed, or do you frequently dream during daytime naps? Alright, the next section is parasomnias. Do you act on your dreams while you sleep? Do you have frequent nightmares? Do you talk in your sleep? Have you walked or sleepwalked as an adult? Okay, this is a sort of miscellaneous section now. Do you frequently travel across 2 or more time zones? Are you more alert in the morning than the evening? Are you more alert in the evening than the morning? Are you awake and alert in the morning earlier than it is time to get up? Do you frequently have heartburn or acid reflux at night? Do you feel depressed? Chronic pain, does it interfere with your sleep? Do you need to urinate frequently, which interrupts your sleep? Do you grind your teeth in your sleep? Do you wet the bed? And then insomnia. Do you have trouble falling asleep? Do you have thoughts start racing through your mind when you try to fall asleep? Do you have trouble remaining asleep? Do you awaken frequently during the night? Do you have difficulty returning to sleep if you awaken during the night? Habits. Do you smoke cigarettes, and if so, how much? Do you drink alcohol, and if so, how much? Do you drink caffeinated beverages during the day, and if so, how many cups, bottles, or cans of tea, coffee, or soda per day? Okay. We're almost there, don't worry. This is now a little bit of history about you. So, social history. Are you single, married, separated, divorced, or widowed? Are you employed or unemployed, disabled, student or retired? Do you regularly work night shifts? Do you work rotating shifts including night shift work? Past medical history, just let me know if you have had any of the following, okay? Hypertension, coronary artery disease, congestive heart failure, stroke, seizures, COPD/asthma, diabetes, cancer, thyroid problems, depression or anxiety, alcoholism or chemical dependency, sinus disease, allergic rhinitis or nasal congestion, nasal fracture, reflux, stomach or colon problems, fibromyalgia, back or joint problems, or anything other you wish to disclose. Okay. Okay. Have you had any prior surgeries? So during the past year, if we refer to your weight, have you gained or lost? And if so, how many pounds? Okay, are there any medications you're currently taking that you need to let us know? Okay, so, alright, what's the dose? Okay, how many times per day? Do you have any allergies? Okay. And finally, in your family, has an immediate blood relative had any of the following? Obstructive sleep apnea, narcolepsy, or any other sleep disorders? Right. Okay. And that is the sleep questionnaire. So the good news is that it's not too serious of a sleep condition you've got. With a bit of attention and a bit of changing of the lifestyle, we can definitely look at improving your sleep. So I'm really pleased about that, because it means we can show you some different sort of herbal remedies and different things you can do to help you sleep better. Okay, so you've got nothing really to be worried about, but I understand it's frustrating and you want a better sleep, so that's fine. Okay, so we're just going to move on to our next little section. Just put this down. Okay, so one of the first things I wanted to show you actually was the powerful impact that having a sleep tea or like a herbal concoction before bed, obviously an hour, you don't want to end up going to the toilet, you need to let it process through your system first, but a few hours before bed, maximum an hour before bed, sleep teas can really help get your body and your mind into a sleep time. So I'm going to show you a few options that are renowned for being really, really good, okay? So the first one we've got here is the Buka Nighttime Tea. Now this is an organic tea. It's a dreamy bed of oat flower, lavender and lime flower. It's naturally caffeine free, and this is very important when you're picking your teas for the evening. You want to avoid caffeine really anytime after 2 o'clock in the afternoon, okay? So in this, it's called Sweet Dreams. So nights can be long when you most need peace. So here is nature's perfect path to restful nights and vibrant mornings. Okay, so there's a gentle crash of oat flower, soothing lavender and silky sweet lime flower. Let rest begin and sweet dreams follow. So you just infuse for 15 minutes, okay, and then that's enough for you to get all of the nutrients from this bugga tea. So that's the first one. Okay. Now my personal favourite that I love to recommend is the Twinings Sleep Tea. It's part of their Super Blends range. So this has got spiced apple and vanilla with chamomile and passion flowers, and it does taste quite Christmassy actually. So it's a very good one for this time of the year. So passion flower is something that's not found in a lot of products, but it is a flower that contributes to normal sleep. So you can have up to 3 cups a day in this one. So getting a full night's sleep is the inspiration behind this carefully crafted blend. The delicious blend combining chamomile, passion flowers, apple and vanilla flavourings is smooth and warming, making it a perfect part of your bedtime routine. Take your last sip and sink your head into a soft pillow. So it tastes quite a lot like, I would say, apple pie. You just put it in the water and infuse for 3 minutes. Okay, so that is the sleep tea blend from Twinings. And finally, this is just standard chamomile and honey. So this one's also from Twinings, but you can get multiple different brands. So chamomile is a really great flower to have in your tea for sleep. So if you lie back gently, open a book you wanted to read for a while and savour some quiet time, you could have your Twinings chamomile and honey tea. So it tastes like chamomile flowers swaying in the light breeze are a magnet for busy bees in the summer months, with just a touch of gorgeously rich honey flavour and a hint of vanilla flavour. It's a beautiful, beautiful blend. So you just have one bag, you leave for 2 to 3 minutes, but you can leave longer if you prefer a stronger taste. So I would highly recommend that you have a look at these wonderful sleep teas, okay? Now, I also have some items I would like to show you that I think could help in your bedroom. There are a variety of aromatherapy sprays and balms that are designed to help you sleep, and putting them on your pillows, for example, can be really beneficial. So actually I'm just thinking now we're saying pillow, I'll show you on pillows because I do have a few pillows here today to show you. Now, the reason why I brought pillows is it's extremely important that you make sure that you have the right pillow to sleep on for you. So this pillow here is filled with down feathers, and this tends to be a very soft pillow, so you really sink into it. But you might be somebody that needs a firmer pillow. So this would be a medium pillow. This has synthetic fibres in it. You can feel that. It feels a lot firmer. So again, that may support your neck better. You might like that. Or if you want to go even harder, you could go for a pillow like this, which is very hard. And you might find that that's comfortable and it helps you sleep in the right positions. So it's just to be very aware that you need to look at the pillow that you're sleeping on and making sure your pillow and your mattress are the best for you to help you have that really comfortable night's sleep, okay? So on this I'll show you. So we have different types of sprays. So this one, for example, is a sleep mist of lavender, chamomile, clary sage and frankincense. And all you do is at night time you just spray on there. immediately relax you and help your body understand that it's time to sleep. So it's very effective if you are somebody that struggles to fall asleep. Now there are other options out there. So for example, this one here is the Feather and Down Sweet Dream Spray. Similar, has less in it, so if you prefer more of a stronger scent of lavender and chamomile, then this would be the one for you because it contains just both of these oils. We also have this one here, which is This Works Deep Sleep Pillow Spray, and this one again has got lavender in it, so it's just in a little bottle like so. Now, you may be somebody that would prefer to use something for your pulse points, so we have things like this, which is a Feather and Down Sweet Dreams Relaxing Roll-On with lavender and chamomile like the spray, but all you do is you pop it onto your temple, or like your pulse point, so you would go up here, on your neck, behind your ears, and on your wrists, and it's really quite nice and soothing. I can really feel that. It does feel very relaxing, and you can smell the scent, and it's just very calming and soothing to help you sleep. If you're struggling that day, you could use this, which is from Badger. It's a cheerful mind balm, so if you're very stressed, this would be a good one for you to delight and uplift the spirits. So this is things like citrus in it, so before bed or at any point of the day when you're feeling vulnerable, to maybe pop this on the same sequence areas as I just showed you for that sort of uplift that you may need. We have another balm type one here, which is again from Badger, but this one this time is for sleep, and it's lavender and bergamot, and again it's like this, and you just pop it on, put it on all your pulse points as we did before. Or you can use this, for example, is one for deep breaths. So to inhale deeply, it helps you relax. You pop this again on your pulse points, and you just breathe in and out, nice and slowly and deeply, and eventually you should fall asleep. Okay. And finally, to show you today, obviously all of that is great, but you can use diffusers and candles as well to get the scents in your rooms. So we have a number of different concoctions or blends of essential oils that you can take away with you today. So this one's called Sleep Well, and this one has got Lang Lang and Neroli, Sandalwood, Mandarin and Roman Chamomile. You can pop these in an electronic diffuser, and they will diffuse in your bedroom and create a mist with these oils to help you sleep. We also have ones for muscle relief, detox, for breathing, all sorts. So definitely if you have an electronic diffuser at home, they would be a good option. And of course candles. So I've got a couple of candles to show you today. So this is a rituals candle, and it says it's not happy people who are thankful, it's thankful people who are happy. You can see, so this is the candle and the red glass. Again, this is a really nice scent and smell. Always make sure to put your candles out before you go to sleep, but if you just want to prepare your room before you go into it with a nice scent, then a candle is a good option. And here's another one here. This one is sea salt and sage soy wax. It smells absolutely wonderful, and again this is like a really cozy, relaxing scent for you to just fall asleep to in your room. Alright, and we also have, bedtime story sleep books here that you can look at. They're for adults, and perhaps you would like to read a little bedtime story before you go to sleep to help you sleep, or have someone read it to always a good option. Or you can listen to ASMR or sleep stories or different sounds that are soothing as well. So all of these techniques are really great options for you to try without having to, ingest any medications. We want to try and avoid that where possible and help naturally, as there's always side effects and things with medications. So I would encourage you to take this all away with you today and to see if there's any particular techniques here that you would like to try at home. And I would encourage you to keep your sleep routine going and your sleep consistent with when you wake up and when you go to bed. Also to avoid caffeine after 2 p.m. in the afternoon, and if you're having those daytime naps, make sure they're before 4 p.m. okay? So that's everything today. I hope I've been a help for you, and we'll see you again sometime soon to see